Oh, thank you. Good morning. I'd like to welcome you to the Profiles Breakfast, sponsored by Ashtabula Leadership, Kent State, and the Growth Partnership. Typically, you would have Dean Stocker or Laura Jones or Greg Myers or probably 4 other people before we got to me, the 7th person on the list at 6 o'clock this morning. I found out I won. So I'm very excited to be here. We have a wonderful program. We're going to hear all about the Remote Area Medical Clinic, April 20th through 22nd at the Ashtabula Mall. And without me screwing it up, we're going to introduce Dr. Herpin and have her explain all about this. So welcome, Dr. Herpin.
Good morning, everyone. Thank you, James. I appreciate the intro. So today we have a brief slide presentation on the Remote Area Medical Clinic, and we are so excited to be the first location in the state of Ohio for a remote area medical clinic. They have been doing these clinics internationally and in the United States since 1985, but never in the state of Ohio. So thanks to our good friends Heather and Ken Johnson, this idea was brought to Ashtabula. They applied for the grant application, and we were accepted. So we are very, very excited to talk a little bit about the Remote Area Medical Clinic that will be taking place next April 20th through the 22nd in the old Dillard's location at the Ashtabula Town Square. Ken Keister and his owner group very graciously donated that space to us, and we were approved in August by the RAM organization that said that that was appropriate for the type of clinic that we wanted to hold. So we have a brief video here. The founder of the Remote Area Clinic is named Stan Brock. He actually was doing international work and had an aha moment, like, why don't I bring it to the United States? We have a lot of needs here. There are a lot of people that could be helped to alleviate their pain and suffering if we could bring free health care to them. So we are going to show this brief video, and then we'll continue.
Millions of families are living in a crisis because they cannot access health care. Millions of people live in pain, suffering from preventable disease and hardship. Remote Area Medical, RAM, responds to their needs by providing free quality mobile clinics. In less than 12 hours, RAM turns schools, stadiums, jungles and arenas into fully functional medical centers able to provide dental, vision and general medical care to thousands. Families are so desperate for this care that they begin to line up 48 hours before a RAM clinic begins, often sleeping in their cars to make sure they get one of those precious numbers which will ensure them entrance. For many, a remote area medical RAM clinic can mean the difference between life and death, between securing a job and struggling to make ends meet. For some, it means providing for their family and improving their quality of life. And for every person who receives care at a RAM clinic, it means stopping the needless pain and suffering they have to deal with every day. Our mission is fueled by private donors and driven by the power of volunteers. They join forces to support people who have nowhere else to turn. We all face hard times in life. Everyone needs a helping hand at some point. RAM extends that helping hand with a mission to provide free quality health care to those in need. RAM works with local partners called community host groups. A community host group gathers resources, rallies sponsors, and recruits volunteers on the local level to ensure a successful clinic in their community. RAM works to empower and equip these local partners to fulfill their own mission and purpose. As a result, RAM and communities converge on a shared mission as we roll up our sleeves and address our problems head on. Together, we can make a difference, and together we can lead hurting people to a better future. As local leaders prepare for the free RAM clinic, They work directly with experienced RAM staff to build effective strategies and address the crisis their community faces. They need to understand the scale of the clinic and what it takes to provide quality care and follow-up. The demands of the clinic include an appropriate venue to facilitate the hundreds and perhaps thousands of potential patients, water and electricity, security, logistical support for patient and volunteer flow, food and lodging, all must be organized, and RAM helps the local community host group to stay on task to achieve our shared objectives. By joining with a community host group, RAM is able to offer a turnkey, comprehensive clinic using millions of dollars worth of mobile units and equipment and a cutting-edge registration system, as well as experienced RAM personnel. RAM also shares the burden of cost with the community host group, so the expense of the clinic does not drain local resources. RAM has always worked to bridge gaps in our healthcare system. A person who needs a dentist cannot go to the emergency room to fix their teeth, and a person who needs an optometrist cannot go to a walk-in clinic to get a pair of glasses. Many families cannot afford their insurance deductible. Unfortunately, RAM may be their only source of health care. When a patient comes to a RAM clinic, they may face a long wait in line, but they receive professional medical services and it's free. They meet doctors who want to help them. They meet people who care. When patients leave, their suffering has been eased, their hope has been restored, and their lives have been improved. They often hug volunteers, thanking them for providing what they needed but couldn't afford. Volunteers leave the clinic knowing their help was needed and appreciated, and the experience brings fulfillment and joy to their lives. Remote Area Medical is a pioneer of no-cost healthcare, and we continue to set the pace to create a better and healthier future for the underserved communities in this country. I started RAM to serve those remote areas of the world that have no access to healthcare. But then I discovered that there were millions of impoverished people right here in the United States. So we've become the champion of the sick and the poor and the underserved. In fact, the voice of millions of people who simply cannot get the care that they need. So you can become part of something that makes a real difference and help us bring free quality health care to millions of children and their families. Please join me on this compassionate journey of hope. And I do trust that I can count on your support. Thank you very much.
Okay, so I think he gave a great overview of the clinic and what the organization's mission and purpose is. I will tell you that my husband, John Decato, and I were first introduced to the medical mission concept through the Kent State Nursing program here. We accompanied Julie Sanita and Tamara Corey and their group of nurses who were studying cultural competency on a trip to the Dominican Republic. That was my first experience, really opened my eyes to medical mission work. My husband had previously done this when he was a resident in the same town in the Dominican Republic, so it's really interesting how, how these things evolve and all the connections we made. But truly, truly a life-changing experience. So I want to thank Tamara and Julie are both here with us today, and Julie is actually part of our leadership team on this project as well. So thank you so much for that. You will see here that the majority of the services offered are primarily vision and dental. So when the patients come to the clinic, they actually have vision exams, and they can have glasses made for them right on site and given to them. Now there is a little bit of a wait for that, maybe about an hour, but quite honestly, many of you I see in the room do have some corrective lenses. You know what the cost for that is. So for these patients, it's just an amazing gift that they're given to be able to receive these. If they need bifocals, those can be made for them, but they have to be mailed to them in 2 weeks. They do also have readers there that they will give to them. Anything beyond that is not something that this clinic can perform. J.P. Ducro and his wife Peggy and I did have an opportunity to volunteer at the Charleston, West Virginia clinic in October. And while there, we observed that whole process. So they actually train the volunteers to make the lenses. It's a very interesting process. So I'm going to ask JP or Peggy to kind of talk to that a little bit.
They were very, very organized with the different areas that you would go through. Even with the volunteers, we had to show up at 5:15. They fed everyone breakfast, and then they kind of broke you off into what areas you were working. I'm a nurse, so I was in medical triage, and he was in general support. And they had a lead that would explain to you what your process was. They went over the paperwork with you, and each area had a team lead. So if you had questions, you could go to them, ask them the questions. Again, everything was very organized. The patients were outside waiting overnight. JP did his best to rally them and get them ready to go through their numbering process, and then they came through general registration. They had to choose, and I don't know if we'll have this at ours, but in West Virginia they had to choose vision or dental because of the providers that were available. They didn't have enough that you could go down both pathways. So their paperwork was color-coded. Pink was dental, blue was vision, white was general medical. So when they came to the nursing station, they got a brief triage. We forwarded them on to the next area that they went to. And then as the day progressed, if they had gone down the vision path and received their glasses or services they needed, if there were still openings in dental or medical, they could then go through the process again. They had to go through registration again, go through triage again, but they were able to get additional services.
That is correct. Anything to add, JP?
Well, the program there was a 2-day. It had been done there before. I believe that the day we were there on Saturday, there was 350 odd patients that were served, and something like $300,000 in medical care. By the time the whole weekend was done, it was over 500 patients and $500,000+ in medical care. That was really kind of an overwhelming figure to me. You know, it was one of the things that I was tasked to do was to help with the check-in as soon as they started letting people in. And you know, it was really moving to see the people that slept out on the sidewalk or in their cars to get these services. And then, you know, to see them come in and then to see the smiles on their faces as they come out. You know, and really people were in very good spirits. And some of these people had said that, you know, I come to this every year. This is my doctor. And, you know, those were some of the things that, you know, really I thought were special, you know, to me. And I know that this community certainly needs these same services. And I know we have such a gracious community. I'm really looking forward to, you know, seeing everybody pull together and the volunteers. And, I want to thank Lori and Heather and everybody who's kind of taken the lead as far as steering this project, and hopefully we can make it, you know, at least every other year, if not every year in the future, and continue to grow it. And I'm sure our community will be the beneficiaries of it. So, thank you.
Okay. Thanks, JP. From the dental perspective, so patients can come and they can receive dental cleanings, they can receive tooth extractions, and they can get teeth repaired or fillings. And certainly this is not my area of expertise, so I do have another part of our leadership team here, Dr. Deborah Balo-Crombie from the Healthy Smile Center. She and her team with Dr. Hoza and Dr. Martin Crombie have been working to recruit dentists from across the state for this process. I will tell you, there are some pictures that you might have seen quickly, but we do have some others from the West Virginia clinic. So RAM brings all of the equipment for this. They do the sterilization and the cleaning right there. The patients are screened, and if they feel if the dentists feel there's going to be a need for a filling or an extraction, they will have an x-ray done right there on site, which the dentist then interpret to see what the actual needs are. Some patients there came on Saturday for teeth extraction in preparation for dentures. So Saturday they had half of their teeth extracted. They were coming back Sunday to have the second half done. I cannot even imagine, but there were a few. Yeah, there were a few there who were doing that. So I'm going to have Dr. Deborah Balo-Crombie talk to you a little bit about what she and her team have been working on for our clinic.
Good morning. For those that I have not met, as Lori said, I'm one of the owner dentists at the Healthy Smile Center. I'm actively involved with recruiting the dental personnel for this project. Dental personnel are the dentists, hygienists, and assistants. We also need non-clinical personnel as well. Our goal is to have 50 service providers a day on the dental end of things. Like Lori said, we're doing fillings, extractions, cleanings, and exams. The denture end of things is also a possibility. I understand that that's being done, but there's a little bit of work involved with that, but that's our goal as well. We have started sign-ups for the dentists, and we have some going, but we've got a long way to go. And really what this is all of us are reaching out to the community to contact your dentist, your hygienist, let them know about this. Please have them get in contact with me as a team. We are all getting out in the community. I'm confident they're going to hear about it because we've already approached many of them. Fortunately, this has been received very, very well. Because of the holidays and everything, we have people that said that they're going to do it, but we need them to sign up. Graham, the administrative personnel at Graham, they're constantly looking at how many people have actually committed. So I know that people are going to do this. We need them to go to ramusa.org. On the upper right-hand corner is a volunteer sign-up, and they need to get their name in there and sign up so that we can make this happen. Because if we don't have enough people that actually are signed up on there, it's going to be very, very challenging. We've also been going to various state meetings. My husband and I went just recently, a week or two ago, to Northeast Ohio Dental Society, and we're branching out that way, and we have contacts at the state level. And we also have contacts in Pennsylvania that have been doing recruitment for us. Out-of-state dentists are welcome, and this is common for out-of-state dentists to go to participate in one of these clinics. In the state of Ohio, for the Ohio State Dental Board, they apply for a temporary license and pay $25. So not a big deal, not unusual. If you have any area of influence where you are able to assist us in recruiting dental personnel, we would be very grateful for that. And that's it.
Okay, thank you, Debbie. For the general medical side of this clinic, what we are able to offer is really dependent on which healthcare professionals we are able to recruit. What you see here are some of the areas that are most commonly needed and provided at these clinics. So with the nursing staff in triage, they were doing some routine screenings. Everyone got their blood pressure checked. If their blood pressure was elevated, they got a first trip to medical. Because for any dental work, they would like their blood pressure at a normal level. So at the clinic in West Virginia where we attended, they partnered with the Charleston Medical Center and their free clinic there. And they actually provided some medications that they could dispense to the patients. It was clonidine to help bring their blood pressure down so that they could then have their dental work done. We are working with both university hospitals and ACMC from our medical perspective. We have yet to determine the full scope of what we will be offering as we continue to recruit physicians. They did have women's health there, and they were doing exams. Diagnostic testing was done, and for some of the patients from Women's Health, those results will then be sent to them via the mail or phone call, depending on their registration information. They also, at that clinic, there's a large problem with the opioid epidemic in Charleston, West Virginia, so they were actually doing hepatitis C testing for the patients if they chose, and those results were available to them within 30 minutes. They then had, through their free clinic, a Narcan site where they were actually providing Narcan to the individuals if they needed it. So again, we are well aware of the opioid crisis, not just here, but in the United States. So We are considering that as part of our clinic, but we have not determined if that will be what we are going to offer at this point. They also, because their clinic was in October, they offered flu shots, and they had some volunteers there from some pharmacy students, some local pharmacies. Now ours will be in April. That is not necessarily a time we typically administer flu shots, but through our health needs assessment that was done here in Ashtabula with the Ashtabula Health Department and the City of Ashtabula Health Department, for which Peggy is part of that leadership team, we are taking that needs assessment to determine what the highest needs are for our local community. So one of the things we were talking about is possibly immunizations for children. And as we get more information on the full scope, we will certainly get that out to you, but that is certainly a consideration for us. In the general medical side of things, if the patients had any needs at all, medical was open to everybody, so you could do vision plus medical, or dental plus medicine. The physicians that I worked with at that clinic were internal medicine, pulmonology in that clinic because they have a huge problem with black lung, and orthopedics. So there, the orthopedic surgeons were able to maybe aspirate a joint. You know, they were doing a variety of things, but it really depended on what the patients needed. One of the things that they did talk about was the need to have podiatry there because of the high level of diabetes and some of the podiatric concerns as far as prevention, because that is really one of the things that we're trying to do is prevent complications of some of these disease processes of aging. So at our clinic, we will be able to offer podiatry. They did not there. I was asked to consult even though I hadn't applied for an out-of-state license, but through working with the physicians there, we were able to help several patients with their podiatric concerns, which was an unexpected pleasure for me that day. Okay, so Debbie already mentioned this about volunteering, and because of Denise's suggestion, Denise DiDonato from University Hospital said, why don't we have some laptops available here where people can register? So Kent State has put some laptops in this room adjacent here, so if you would like to register today, you're more than welcome to. In addition, these cards have been placed on the tables. Please take some. There are more in the back if you would like to take some of those to your place of employment, to any of the organizations, your nonprofit organizations that you may be part of. We would greatly appreciate that. I think the best advertisement is word of mouth. So we have a phenomenal attendance here today, so hopefully we will be able to get that word out. Some of the organizations that have already agreed to partner with us, obviously University Hospitals and Ashtabula County Medical Center. I've also reached out to Lake Hospitals and most recently to Trumbull Medical Center in Warren, Pennsylvania. From a general medical perspective, Crystal has agreed, and I'm not sure if they had their name changed yet, but they will soon. They have agreed in two ways to volunteer. They have given us a financial donation as well as made this their community project for the year. So both Plant 1 and Plant 2 will be volunteering during this event. The Ashtabula Rotary, through the work of Julie Hart, right? Hunt, I'm so sorry, Julie Hunt. They have made a financial donation to this project as well, and their members, as well as other Rotarians throughout the county, have agreed and have already started to sign up as volunteers. And then Steve Arselik, another member of our leadership team from Eagleville Bible, they have made a financial donation, and their members there will also be volunteering at the event. So we have a good start, but we absolutely need more. Dr. Crombie's goal is to have 50 dentists there. So RAM actually has 140 dental chairs available that they can bring up via tractor trailer plus all of the equipment. So wouldn't it be great if we had even more than 50? And I definitely think that with the support of the community, we can do that, and especially since it's been the first one in the state of Ohio. Now, since we decided to do this, there will be another location in the state of Ohio in Massillon next August. So this is catching on, And what we learned from going to West Virginia is that some of these people traveled up to 6 hours to actually come and receive these healthcare services. So if you think about what the recommendations are for dental, they usually ask you to come twice a year for exams, right? So these patients are doing that, and they are driving to be able to have this access. I had no idea. It was just amazing to me that they were doing that. One of the other responsibilities that Peggy touched on as far as the host group is that we need to provide food for all of our volunteers. Now, at the clinic in West Virginia, they had 425 volunteers there on Saturday. So because the clinic starts at 6 a.m. and doesn't finish until 6 p.m., we are responsible to provide food, breakfast, lunch, and dinner. So what we noticed, or what they told us they did there, was partner with different organizations in the community and different businesses to provide food. So for breakfast, they had a hot breakfast provided by a homeless shelter, and they were used to serving 500 people a day, so it was no problem for them to do breakfast. For lunch, there were several vendors that provided food, to include Panera Bread, Subway, and Chick-fil-A. So we have started down that path about trying to partner with some local businesses and organizations in our community. To date, we've had commitments from Grand River Rubber is going to partner with Tony Orlando from Orlando's in Kingsville. They're going to provide food. Country Club Retirement Center and their chef are providing food. The St. Peter's Episcopal Church and the United Methodist Church have also agreed to provide food. But there are many needs. We're anticipating, they tell us to budget for 375 volunteers per day. Our clinic is going to be a little bit longer, so it will be all day Friday, all day Saturday, half a day Sunday. Our setup will be done on Thursday when they bring these tractor trailers in and get it set up. And we have partnered with some of the local high schools. St. John's students and their Key Club will be helping us set up, and I think part of the athletic teams. I know there have been some contacts made with some of the other schools, and we have yet to get a definitive commitment, but hopefully we will, because it's a great opportunity. My daughter, or our daughter, Natalie, actually attended the clinic with me, and she was a little bit nervous about going, but she could not believe. She said, "Mom, I'm definitely going to do this." She signed up right away. So I think once you're there, I'm a visual learner. I mean, this seemed really amazing, just learning about it, but actually being there and participating, it just humbled me. It was just amazing. So I think, and the only thing that we really provide would be water bottles for the patients. It just gets too cumbersome and too complicated. The RAM organization said, don't do anything more than that. So we will be looking for donations for water bottles. I should tell you that from the vision perspective, Walmart has taken the lead as in their vision group. They are helping us recruit our vision specialists. I do not have an update on that at today's clinic, but we'll certainly keep you guys informed about our recruitment for vision. But certainly that is something that is a huge part of this clinic. While in Charleston, we did get to meet the students from Ohio State University. They have been doing this for several years. I think close to 10 is what she told me. Unfortunately, the dates that we chose are finals week at OSU, so that group of students will not be able to help us. But through their alumni, who many of them still practice in the state of Ohio, we are hoping to gather that group of individuals that have already had experience with this. Okay, so I think I have touched on the majority of our leadership team. Sherry Dietrich, along with Julie Sunita from Kent State, she just left for a trip to Dubai with one of her instructors, so she's unable to be here today. Dr. Jim, how do you say it, Deb? How do you say his last name? Lalamandir. He is from Case Western School of Dentistry, and he is the chief of the community dentistry program. So several years ago, RAM was scheduled to come to the state of Ohio, but because of an outbreak of the bird flu, that program was canceled. Jim was one of the lead physicians on that leadership team, and he is working to regain those connections with those doctors that were involved and had an interest then, as well as to work with new doctors. One of the challenges he has, and Representative Patterson can speak to this a little bit, is the recruitment or the ability for out-of-state physicians to actually practice at a volunteer clinic. It's a little bit different than what the dental board is able to do. We, however, have to pass some legislation, and maybe Representative Patterson, you can explain this a little better than I can, but to date, we have not changed that legislation. So we, at this point, are looking only to the physicians that practice within the state of Ohio. Unfortunately, at Case Western, many of the physicians on staff there are out-of-state licensed. So is there anything you can add to that?
No, we're working on it. We're using model legislation from other states to get something ready to go. Obviously, because of the short timeline, we won't make it for this year, but we will have something in place moving forward.
Okay.
Thank you.
Thank you.
The medical board, it's a $125 application fee for out-of-state for a volunteer. So there's still that opportunity for physicians that are licensed in another state if they want to pay it a little bit higher for volunteer activity. But the best way would be to pass the legislation for next year.
Okay. Thanks, Tina, for that update. Okay, so these are just some of the pictures from the clinics that we attended. The 3 tables up there, they're all frames for glasses, and they're brand new. They're not used or anything. So the patients, once they get finished with their eye exam and they have their prescription in hand, they go pick up the frames that they would like. And they have frames for children as well as for adults. It was pretty amazing. Okay. The processing is a very, in dental, so they have a little color-coded card system so that they know when their seats are available for new patients to come as well as for cleaning. It was very impressive. And they provide all of the personal protective equipment. Everything is done there. We did have to make sure we had adequate water resources, which we do at that location. Okay. Our preliminary budget was, it's a lot higher than what we initially anticipated. They told us to plan for $5,000, but in looking at this, our budget is a little closer to $30,000. Now, obviously, some of this has already been donated. We have cash donations, $2,500 to date. I haven't put a value on the food donations yet because I don't know for sure how many meals that these groups who have volunteered are planning to donate. We put that at $5 a person for those meals. So you can see we have a long way to go, but we already have had many, many in-kind donations. And that is not reflected here. So I don't want to scare you. I definitely think we'll be able to reach our goal through the generous support of the Ashtabula County. Okay. You can skip that. So we are almost out of time. I do appreciate all of your attendance, and if you want to ask any questions, you're certainly able to do that, but I'm respectful of your time. I know you all have to get to work. So just wanted to wish you a very Merry Christmas and Happy and Blessed New Year. And just a little plug that's not really for this, but they are sharing that they're using the same space as us this weekend at the Dillard's location. They are doing that live nativity scene, the Star of Bethlehem, which is free and open to the public as well. So, if you're interested in getting into the holiday spirit, you can certainly take advantage of that. Okay. Thank you.
Well, thank you very much. What a wonderful program. I'm sitting here, I saw my eye doctor last week. I have to go to the dentist again tomorrow. Things that I'm not excited about and you take for granted when people aren't able to have those services. So thank you both very much and everyone who's supporting this program. There is no Profiles Breakfast in January. We will be having one February 7th. So hopefully everyone has a wonderful holiday season, and we'll see you next year. Thank you so much. It's not even 9 o'clock. The 7th guy on the list does a good job. So thank you very much.